Ladies and gentlemen, welcome to the resumption of our sessions. We have been quiet a while, but we have resumed, and everything will go as planned. So today we start research methodology, and our speaker is Dr. Walter, and I'm sure most of you knows him now because he has been with us for several sessions. He's a very active and very enthusiastic in teaching. So we thank him for that. So without wasting any more time, I would like to welcome Dr. Walter to start the session. Again, I would like to tell you that you can write your questions as Dr. Walter is presenting, so that you don't forget in the chat section, or you can note them yourselves, and then we will have a question and answers at the end. So Dr. Walter, welcome.
So thank you very much, and I would also like to welcome you all in this session. And then this is just a continuation of academic writing, and we are in the aspect of writing proposal, research proposal. And then we did the chapter 1, but also literature review, and now we are in the research methodology. So I will take you through the two subtopics, that is the concept and the descriptions about how should researchers locate study area, and how can we choose study population for our research. So I would like to welcome you, and let's be together throughout this session. So, sorry. So our session will cover almost 5 specific objectives, of which all of us, by the end of this session, we are expected to have at least understanding of the basic components of the methodology and the concept of study area or setting, but also to know at least the concept of study population, and the others say is target population or aggregate. And to show at least some examples of how to write paragraphs about the study setting, but also paragraph descriptions about the study population. So this will be our specific objective in this session. So to start with is the basic components of the research methodology, or research methods and the materials. And then these are basic components, but they may vary depending on the training institution or projects or companies. So we have study area is one among the components of study research methodology. We have study design, study approach, target or study population, sample size determination, sampling procedures or methods, eligibility criteria, where we find the inclusion and exclusion criteria, data collection in methods, or some other people call them as data collection procedures. We have also data collection tools, and we have validity, reliability of the research tools or instrument, variable definitions, and variable measurements. And also we have data management and analysis as one among the components of research methods and the materials. And then at the end, we have ethical consideration that you as a researcher need to prescribe for people to know that you have adhered some of the ethics, research ethics, be it national or international. So these are the basic components of any research methods and material section in the proposal. So we are going to start with the second objective, going deeper, at least to fish more understanding, descriptions about the study setting, but also study population is the objectives of this session. So suppose you are given these questions here, and then you are told to say if in the aspect of study setting, study area, which one belongs to study area and which one belongs to the study setting. Also, which one belongs to the study population or target population. So we have some brain teaser in the form of questions. So for instance, your friend is telling you that I'm going to conduct my research in the health discipline. So you're asked to tell, is it a study setting, saying that in the health discipline, is it a study setting, is it a study area, whichever. So you're asked to tell someone, can you tell us what does it mean? Is this friend going to conduct a study as a study area or setting? And then some other friend of yours is telling you that I'm going to conduct my research in Dar es Salaam region, Tanzania. So the question is it a form of study setting? Is it describing a study setting or study area? So we need to have an answer. If we are given an opportunity to give an answer, which answer will you give between study area and study setting in the question number 2? And then you have a third friend who is telling you that I'm going to conduct my research in the laboratory. What can you say? Is it a study area? Is it a study setting? You see? So these 3 questions tells us how to define a study area versus the study setting. So what is a study area and what is a study setting? We as researchers needed to know, we are supposed to know the difference and how should we go about in writing and prescribing them in our research proposals. And then the first question is about the study population or study target population. So your friend is telling you that I'm going to conduct my study on teenage pregnancy among 10 to 19 years adolescents. Now, you are asked to tell your colleagues, is it 10 to 19 years adolescent a study population or a target population? So if we were able to answer these questions, mean that you'll be in a position to know the difference between a study area and a study setting, but also the difference between target population and the study population. And then this is the target of our session today. At least by the end, I'm sure that you are going to have at least understanding of what is a study area and what is a study setting, but also what is the target population and the study population. So you may tease yourself and find the answers for these questions later. But through our session, you are going also to get some understanding about them. So we have a study area and we have a study setting. Now, based on the subtopic of this session, we're going to concentrate on the study area, but you can find it at some point. We also describe what is study setting for you to answer the aforementioned questions in the previous slide. So you can define study area as a concept. As a concept that is a subject matter, a discipline. So if we say my study area is in healthy, or in humanities, or in social sciences, or in education. So that is, you are defining study area as a concept. It's not a tangible, it's not a physical. It's just an ideal situation. Where is your area of interest, where your research title is coming from, or your topic and a study is coming from. So you can define study area as a concept that my study is only maybe healthy or sociology issues, mathematics issues. That is a study area also. And then you can define a study area as a physical or geographical location. And then here we are talking of a large physical environment or setup. So you see, this will be my study area. If we define it as a physical being or geographical location, mean that it's a kind of a large environment or space or setup. We can talk of continent or zone, country, region. Those physical can be defined as study areas. So when we say study area, mean that we are in the broad perspectives. See, you tell someone, you tell your colleague that in a broad perspective that my study, if we say concept, belongs to this area of interest. But if we say physical being or geographical location, it's a wide, which is not specified yet, but you are going there. Now, if you narrow it down, you go to the specific, it's where you can find the study setting now. And then study setting is within study area. So it's also a geographical locality or specific environment or setup where you want to go there and collect data for your research. You see? So this is a study setting. So you are broader when you are talking of study area, but very specific, you are talking of study setting. However, we have several scholars that may provide some more definitions or descriptions about these two concepts, that is the study area and the study setting. Now, for the sake of this session, it's just a summary, and we can find more description about it by reading or finding scholarly works or books, because we have research books, see? You can find there more elaborations about them. And then examples of study setting, you can say, I'm going to conduct my study in the laboratory, in schools, in wards, in households, or in the forest, whichever the place, which is very specific, and you focus that specific area because you know that your data, your intended data is found within that locality. That is a study setting, see? So this is how you can at least differentiate between the study setting, study area and the study setting. Same. Now we have some conditions when you want to write paragraphs or descriptions in your research proposal when you reach the section of methodology, but it is a subsection of study setting. How are you going to write it? Which conditions should you consider before even starting typing your descriptions in the research proposal? So here I have I've provided some of the conditions that we as researchers, at least at the basic level, we need to consider them when you write your paragraph describing your study setting, you see? And most of training institutions in our settings, academic works, prefer to use the study settings, which is more for specific area where your data is going to be collected. So one of the criteria or condition that we should consider, and it should be there in the paragraph, described, very well described in the chronological order, is description of the geographical location of the study setting. You see? So here, you go very deep, detailed, giving your readers more details on the study setting that you are going to conduct your research or study area. Because there are some of your readers are not originated from the study area that you are going to collect your data or study setting that you are going to collect your data. So you need to inform them because your work will be read by various people from different locations, from different areas around the globe. So you need to prescribe the characteristics of the geographical location, which means at least you show where is it found, I see, and what is the characterization of the population. If you have data that prescribes the census, the last census that was conducted in such a study area, you provide it to a reader. But this population is the entire population, and then you narrow it to the focused population that you want you to be given your data from. And then you can also prescribe public services that are available in the study area or setting. And then social cultural norms of those people which are found there. And then these all geographical descriptions depends on the topic under study, variables that you have, and the study population that you have. So for instance, we are studying maybe people from Tanzania. We have the region which is Dodoma. So you need to prescribe where is Dodoma located in Tanzania. So that if someone from Malawi reads your work, know that if she or he comes to Tanzania, knows that Dodoma is one among the regions found in the central part of Tanzania. It's a hub of political, whatever. So you give descriptions. And according to the previous census, 2022, the population was this one, males, females, whichever. And then when you prescribe the population, you prescribe the information for the population of Dodoma, maybe, you say maybe male, female, and then you go direct to the proportion of your population of interest. That is the population that you have intended to study and to be given data from them. So you describe them. For instance, you are studying adolescent. You go further that males are this one, females are this one. Among these adolescents accounts for this percent. See? So you describe also include for the study population that you prescribe in the research title. And then you describe some information based on the public services that are available there. And then this also depends on the variables you have. So for instance, you are studying teenage pregnancies. The public services that you are supposed to prescribe in this section is the health services that are available in there. How many health facilities alongside their levels, maybe dispensary, whichever, to the top level, which is regional referral hospital, because we are talking of the region, you see. And then if we are studying issues around maybe eating habits, it's where now you can also prescribe information about social cultural norms, say agriculture issues. If our topic is on eating habits, maybe dietary intake, dietary diversities, malnutrition, you see, you can add more information about that variable if it is there in the title. So this is the description, you give descriptions, but you should be very careful in describing the features of the region or the study area or setting, that you only prescribe geographical descriptions that are relating with your research title or the scope of your study. So if we are studying eating habits, for instance, you see, people are not expecting, when you prescribe the information about geographical descriptions of that area, are not expecting to see maybe the Dodoma region is above maybe 22nd latitude to the right, whatever, above sea level, to the top is near to maybe to the clouds. Whatever. So these issues are not closely linked with the issues of eating habits. Boundaries to the west is bounded by this region. What does it concern with the eating habits? You see, so you limit yourself prescribing geographical descriptions only that are relating to the study, which are relating to the variables that have been provided in the research title. You see. And then you must be keen enough when you write your paragraph for describing the study setting. Mind you that you should consider fundamentalism for conducting such a research in that area. This is just a thing of giving people the rationales, the reason. Why are you going to conduct your study there? Why are you interested to go to Dodoma region and conduct your research there? So you need to provide some reasons, you see. And then this reason, if you provide some reasons, why are you going there? Mean that you are problematizing the study area. You give problem. And then this problem can be, depending on the study population, we have two problems at least at a basic level. We have such problems under public concern, but we have such problems under professional concern. So you can find your research is basing much on problems of public concern. If we are talking of malnutrition, you are talking of poor dietary intake, non-communicable disease. These are all public concern, problems of public concern, you see. So if you give a rationale that I'm going to conduct a study at Dodoma, because there is high prevalence of malnutrition among under 5 children, mean that you attach a problem to the region. And this problem is the one that has convinced you to go there and conduct your research. And then by doing so, mean that you are problematize your study area or study setting. See? There might be issues of culture, whatever, but those belongs to the problems of public concern. But also we have problems of professional concern. Maybe in the Dodoma region, people are more killed or people are dying. So each day are dying in health facilities. And then you want to find out why are people dying in health facilities than when they are at their homes. So if you go there and study healthcare providers, mean that your problem is more of professional concern. I am doubting the professional competences of healthcare workers in providing healthcare services to people, which is more of quality, cost-effective care. Professionals, and our title is more of professionals, mean that here you provide information about the problem of professional concern. See, I'm going to Dodoma because it appears that people are more dying when they are in health facilities than when they are in the street or in the society. Now I'm going to study how healthcare providers provide care to patients or to clients. Now here you will be dealing with the problem of professional concern. So you need to attach a problem to the study area or study setting that your research is going to be conducted. See? And then when you provide a problem, you are reminded not to use research-informed reasons, but rather use researchers' reasons or researcher-based reasons or research-based reasons. The same. Researchers-based reasons are not recommended. You need to provide research-informed reasons for you to go search a region or study area or setting. See, and then when I say use research-informed reasons, these are the reasons that you get from existing knowledge, and then existing knowledge is from published works, scholarly works, or from reports from local available reports. For instance, hospital-based data. If you are not getting published data, you are also recommended or advised to use locality data. See, locality data is like you have found no published data on your topic of interest, but you can come a step down, one step down, and at least demonstrate locality data. If we are dealing with the hospital or health facility, it's a health facility data, you see, or hospital-based data, you see. So those data are the ones that should inform you to go in that study area or study setting, and not your own reason. And then once I say researcher's reason, is like I'm going to conduct this research in Dodoma region because I am living within Dodoma region. This is researcher reason, and it's not recommended at all in your proposal or in your academic work. I'm going to conduct this research in Dodoma region because of financial constraints. This is your researcher's reason. It's your own reason. It's not recommended when you write those information described in study area. It's not recommended. I'm going to conduct this study at the Dodoma region because the researcher is living near. Those reasons are not recommended, and you are advised to limit yourself for prescribing in the study setting such reasons of why are you heading there. It's better, at least you can say, I'm going to Dodoma to conduct this research at Dodoma because little has been conducted about the topic under study in that region. But you should not depend only in one reason. You find at least 2 and 3 or 4 for you to for those to support you that why are you going to conduct your research in the Dodoma region. So limit yourself to provide researchers reason to the study area or study setting. Rather, use research-informed reasons. You at least have some data that prescribe the problem to that region. See, that will support you, and the people who are going to read your work will understand why are you going to conduct your research in such opted study area or study setting. See. And then mind you that if we were sitting here writing your proposal in the section of study area or study setting, struggle as much as you can to find the wow effect from your readers. If I'm reading your work, I should reach a point that I should say, wow, this is very attractive and a very convincing study to be conducted in the Dodoma region. See? Make your readers say the word wow in the study area or study setting section, which is found only in the methodology of your research proposal. So wherever you are going around writing each and everything in your proposal, once you are writing the study setting, make sure that you tune it, you fine it, you write it very scientific and academical for your readers to say, wow, this is better or best research in this setting, or this is the appropriate area to be chosen for conducting this study. You see? So we are all after the wow effect from our readers. If you find it, you can share your proposal to your colleague, and then ask him or her, please, can you read the section of study area? And then just sit silently. And then if your colleague is reading to the end without wow, this is an indicator that your study area is somehow not attractive. See, you should be thinking. Those are self-testing. You write it and share to someone, and then look at him or her reading the section to the end, and then see what is happening from her. And then if you know, wow, mean that you should say, thank you for reading my section, and then let me go and maybe refine it so that I can later on get the word wow from you. So you go back and sit down, write it, convince your readers. If I am reading your work and reach the full stop of the paragraph describing the study setting, I should say, wow, this is the best description of the study area or setting this guy has provided. You see? And then the other condition is limit yourself, as I said earlier, describing unlinked parameters of the study area of your choice based on the study topic or research topic. See, describing you are studying maybe agriculture. You're studying agriculture. People are expecting to see their issues about weather. You see, rainfall, sessions of rainfall per year, crops, which are cultivated in that area, eating habit of people there, what is health problems that are linked with the agriculture. People are expecting to see those information. But if we are studying issues around agriculture and they were providing issues of political issues, the most dominant political party there is maybe Chadema, CCM, Kafu. People are not going to understand you. How are they linked with the eating habits? You see, so you first provide proximal information to the issues under study. And then if we find this very relevant, to attach distal information to describe, to feed more information to your area of study, I think it would be better. But you are recommended to start with the very proximal information to the topic under study when you are prescribing the section for study area or study setting. Yes, so the other condition that we as researchers, academic researchers, we are advised to limit ourselves on that kind of information. But the major issue is here, you need to answer two questions. Why questions? So people, if they are reading the paragraph of the information that you have written, prescribing or describing the study area, people should see the why question. And then if you have written it well, provided the reason in the bullet number 2, means that you have already answered the question why. And then you will be remained with the question how. Because just to remind you, the methodology, method and materials chapter or section is characterized by only 2 questions. And some, they have 3 questions. But if we are able, in each component that I have mentioned in the first slide, to attach, to answer the question why and how, mean that your methodology will be academically written and scientifically also written. See, so the whole methodology answers the question why and how in each component. So there are some components that will need all of the questions, why and how. And you can find the one component needs only why answers. And the sum of the component may need only the how answers. You see. So these are the only questions that if we are able to answer them while writing your paragraph of each component in the methodology section, you'll be in a position of writing very scientific methods. People will see that, oh, wow, this is real research methods, because they see you as a researcher, but they see the action that you are going to conduct there while you are doing your research. See? So even the study setting or area needs to be answered by the questions why and how. Why are you going to conduct this study in the Dodoma region? And I said, remember that one. Do not answer this question using researchers' reason. I'm going to start this research in Dodoma region because I am living in Dodoma, or because the researcher lives near Dodoma, or because of financial constraints, or because of time limited. These are researchers' reasons, and they are not recommended at all. But you can say, I'm going to conduct this research in Dodoma region because regional data show that the magnitude of malnutrition is higher in Dodoma region as compared to other regions around the country. This one is acceptable when you are answering the question why. But also you need to answer the question how, which is also linked to the sampling procedure. But you can predict the how answers in this section of study area or study setting. How are you going to get to Dodoma? If we were driven to go to Dodoma because of the available data about the problem under study, I mean that it's obvious that you have selected or you have opted to go there purposely. And then you can say the how. How are you going to get to Dodoma? Dodoma will be chosen purposely because the magnitude of this problem is reading there than in other region in Tanzania. See? So you need to answer the why and the how question in the study setting or paragraph that describe the information about the study area. See? So these are at least the basic condition that you and me as researchers need to consider when framing our paragraphs in our research proposal when we reach the section of research methods and the material. See? So here I've provided an example, a paragraph which has been written to prescribe the study area. And then it's you and me to find it and maybe critique it, analyze it, evaluate it. Does it fit the characteristics of a paragraph on a study area or study setting? So you can have an ample time after this session. You can read it very slowly and find what you have discussed. Are they prescribed here? And then this one qualifies to be a descriptive study area or study design. So we have a title there, and then from the title, you read these paragraphs, 2 paragraphs, and then at your time, you can give some answers, whether it qualifies to be descriptive of the study area or not, based on what we've discussed, and some more information that you can get after this session from existing knowledge, scholarly works that have been published prescribing study area or study setting, but also some dissertations that are online or theses that have been published. You can also find more information to understand what are we saying here about how to write a study, the paragraph of study area or study setting. So you can find it, and it's a kind of a brain teaser at your time. You can critique it. Yeah. So this is a segment of study area or study setting. And then now maybe we see a bit on study population. See? So we have target population. People also write it as a study population. Yeah. So we have various scholarly concepts, definitions of what is target population, what is study population, what is sampling frame or study research frame or study population frame, whichever. But for the sake of this session, we are going also to fix ourselves to the study population, as the subtopic says. But this does not maybe juniors not to consider other concepts that may help us to understand more on what is real study population and how should it be written in a research proposal. So you can define also a study population as a concept. Once you provide a definition as a concept, a study population is a concept, mean that you are talking of human or non-human subjects or population. It's a when we talk of study population, it's a subset of a target population. So from there, you can see that which one is broader than the other between the target or study population. So you see, study population is broader than a study sample. So see, we have an addition of another concept here. So you can get the target population, study population, and we have a study sample, you see. And then people ask you as a researcher, which one is broader than the other? And then which one is very specific than the other when you are intending to write a research proposal. So here is at least a basic answer to the. You see, if we are told that study population is broader than a study sample, mean that the study sample is a very minor, is a very specific unit of the study. You see, So study population is broader than here, and then it also target population is broader than the study population. So you are general going to the specific. General is target population. You go to the middle, you get to study population, and then later you are after study sample. So this is as a concept. But the study population is a physical being. We are talking of tangible people. If I meet with you physically, hello, how are you? I'm fine. How are you doing? Mean that this is a study population in a physical contact. You see? So in an ideal situation, you can tell someone study population imaginary or hypothetical. You describe just the information. But if it comes to the point that you need to point to who is the study population, you touch an individual. That is a physical being. The definition of a physical being of a study population. See? So study population is an idea, or study population is a tangible object or human being. Yeah. And how can we as researchers classify study population? So we have finity study population. And here, as a researcher, you need to be keen enough. You see, sometimes we are writing the study population among teenage pregnancies, among teenagers, among healthcare workers, among pupils, among students, among vendors. You see, and then if someone asks you which category or which class is this population, you are failing because you didn't go deeper and make yourself have understanding only what is a study population and how can we classify them. So in the basic, we have at least four classes of population that you are mentioning in the title. So we have affinity population. These are those that are countable. You can count them and see. And then if their proportion is slow, is small, I mean that is the one that determines the study design. And then people can challenge you. You are going to study people with hypertension. And you are saying that is cross-section, analytical cross-section. You see, these people are accountable. Why can't you do case study? See, it's obvious because study population also gives you a room to determine a study design. You see, I'm going to study people among this study is going to be conducted assessing this one among Ebola patients, and then you are saying analytical cross section. It's very difficult, and then you will be in a position that you may also get some challenges to defend your work because study population is not tallying well with the topic you're studying. See, so it may help you. I have provided it for at least to give you an awareness on how can you analyze your study topic versus study population. By way of infinity, those are accountable, and then this is always the studies that are conducted in laboratories. That is studies microorganisms. See, you can have infinity population, and I say the population may be human or non-human being. And then we have existent. Existent is we living organisms or non-living organisms. Yeah. And then we have hypothetical. See, hypothetical is if you are writing a research proposal and some are finding the research titles which are unique and say uh, this study is going to study something maybe among devils. Now devils, how have you ever seen a devil? See, this is an hypothetical. See, so if you are dealing with the study population, which is very, very strange, and then it's imaginary population, it's where we are saying that this study conducted on the hypothetical population, and you can declare it that this is an hypothetical, just imaginary. Yes, so this is a basic knowledge on how you can classify your study population And then it can help you on how to determine or to decide the study design. See? And even approach sometimes. Yeah. And then what can researchers need to have to identify study population? What do you need on your table for you to decide which population should I take? This depends on, as I said, area of interest. If we are studying maybe consumers of financial organizations, means that your population will be those who have been registered for, they have accounts in banks or financial organizations, small financial organizations, such as in Tanzania, we're calling them as Vikoba sometimes. See, you are going to study people like those because you are dealing with the finance issues about income, yeah, among people. So also area of interest can inform you which study population can you opt, but also problem of public or professional concern. If the problem, as I said earlier, if the problem is more of public concern and it faces under 5 only, mean that your study population will be under 5. If it faces pregnant women, mean that your study population will be pregnant women, because you are saying that I'm going to study anemia among pregnant women, you see? So the problem that you are studying may inform you which population there. So it may happen that you are studying this topic, but the population that you have plugged in that title does not correlate with the topic you study. It happens like that. So we need to be alert, and we need to be very careful when we opt the study population. We need to link it with the study topic, see? And then even variables or constructs that have been provided in the research title may direct your reader to see whether your study population is appropriate based on the topic you understand or not. You see? So those are some of the issues that you need to consider. You need to have them for you to decide to make an appropriate decision. What exactly is my study population based on this topic of my study? Yes. And then what is so important in selecting a study population? You need to consider your field, because if you are studying, your field is healthy, mean that at least you fix yourself to the field, unless otherwise you are in a collaborative research. It's where now you can sit down and make a negotiation, discuss, and then to the end you reach in consensus, you engage yourself to the research from other fields. But academically, if you are in the Bachelor of Nursing, people are expecting you to fish more what is there in nursing for you to contribute new knowledge for promoting your profession. See? So at least academically, if we are reaching in the stage of writing projects, you can write it from any of the field because it's open. But academically, we are recommended. It's not a force. It's not mandatory, but it's recommended. At least you fix yourself writing within your field. See? Because people know that you understand better things in your field than when you are exposed to a very new field, which is very distant to you. You see? But also the problem of a phenomena to be addressed will inform a variable availability of the people. Availability of your study population also may inform you which population to opt. You should not force yourself to opt study population of which you see that it's very difficult to reach, very difficult to access him or her. For instance, you are saying this study is going to be conducted to assess managerial implication to the economic status of the country among presidents. So you are putting yourself in a trouble to find the presidents, and then you know the protocols of finding the presidents. So at least academically, you find the scope that you are able to reach. And then those that you are saying that your study population must be available, easily available, but accessible. They can be available, but not accessible. And then you see, I'm going to study eating habits among maybe Sandawe people, maybe Adzabe people, Adzabe. You see, it's very difficult to reach them first, and then it's very difficult to access them because they are not mingling with the normal people. If they see normal people, they chase the people because they see that they are dangerous to them. So don't force yourself to study population which is not readily available and you cannot access them academically. But if you reach to the project level, you can put any study population. But academical, for you to graduate, for your readers to understand your academic work, at least fix yourself to the population which is available and you can access it. Sometimes you can force yourself maybe to study something, and you know that maybe, for instance, you are in the health field and you are studying healthcare providers. However, you know that currently we have shortage of nurses, and then those who are available in the system, they are occupied with the shift because of many clients, many patients. And then once someone enters the shift, is very busy, no time to spare for resting. You see, very busy. And then you're forcing yourself to study healthcare workers. This will be very difficult research to you because they will be available, but not easily accessible because they are very busy providing healthcare patients because they are few, they are shortage, one shift, one healthcare provider. How are you going to access it? And then ethical consideration will be there. See, so you are recommended at least to find the study population which is available and easily accessible. So you can also consider social demographic characteristic profiles of those people. And then if you read the documents which are existing, you can find them. We are sticking ourselves to prescribing information only about the demographics. But we have some more information of those individuals about psychographics. We have also behavioral characteristics. But sometimes we are forgetting these two. We are dealing only with the demographic characteristics. You can see a research is being written, and then in the section of social demographic, you can find only social demographic. But psychographic characteristics, where are they? You see, aspiration of people. You see? So we need also to consider psychographic characteristics of people, but also behavioral characteristics of those people. And then these all should be also in the section of social demographic characteristics. But sometimes we are forgetting the two. We are dealing also only with the social demographics. But they are all in all, they help you to decide the study population. See? Yes. So how to reach the study population is our objective says. Now, we have a number of ways to reach your study population, see? And then these approaches or these ways considers the advanced science and technology. So we have conventional ways to reach study population, and then we have technological-based ways of reaching the study population. So you can reach conventionally, you can reach them physically. That is face to face, physical contact. See, this is conventional way to reach your study population. But if you are in the science and technology, and your literacy in technology is good, you can reach them using technology. So where you can do research online. You can send questionnaires through emails, through phone call. You see, those are the kind of ways to reach your study population using technology. So we have a conventional way of reaching your population, but we have technology-based ways of reaching population. As a researcher, we are advised to sit down, comprehend well the ways to reach study population, and opt the appropriate way to reach your study population. It's not because we have technology, we are forcing ourselves to use technology while your topic need physical contact of people. So we need to analyze our work, to analyze ourselves. Which way should I reach? And then here is a kind of a forest that is more, some researchers hide themselves here because they don't have money. They force themselves to reach their study population by technology, thinking that is very easy to distribute questionnaire online. But your topic would need physical contact. So you need to analyze your topic well and see, is it needing physical contact of the study population, or can I even use technology? If you are dealing with professionals, it's obvious you can opt technology-based ways. But if you are dealing with the people whom the education level is questionable, you don't know the status of education there. You are dealing with indigenous people, you see, in the community there, in the remote areas. And then you are forcing yourself to use technology-based ways. You will be wrong, you see. And then your readers will question your work, whether it's very scientifically written or not. And then it's obvious not scientifically written because evidence show that you are forcing yourself to do this. Behind it means that you are escaping the issues of financial implications because you know that traveling here to there costs, eating costs, sleeping costs, coming back costs, plus photocopying questionnaires or research tools, it costs. And then using them as a place to hide yourself, you are not hiding yourself. You are showing yourself in the public. If you are alone, you can cheat yourself that I am hiding. And then this is called self-plagiarism. You are hiding yourself while people are seeing you. I see. So these are the ways to reach your study population. And then there are several things to think about as a researcher when it comes to the issues of study population. You need to consider research ethics. It's where now we have a segment which is called ethical consideration, ethical approval, clearance, consents. All of these, I say, we need to consider them. Declaration of health ethics need to be considered here. And then you need to consider of eligibility criteria, where we have inclusion and exclusion criteria. But the research activities, that the research activities in your study need manipulation of people or no manipulation of people. So if manipulation means that people are expecting that this study is going to be interventional study, are the ones which manipulate people. But if none manipulation, no manipulation, means that these are observational study. It's like you are going to do analytical cross-section study, descriptive cross-section study, case series, case studies, whichever the study which is not manipulating individuals. Manipulation is like if you are recruiting people and you train them, the training is a kind of manipulating them. If you are taking sample of blood from them, this is called manipulation, the participants. You see, if you assign tasks to the study participants or population during research, this is a kind of manipulating them. See, and then you need to consider researchers' position. And then this is a big challenge to most of us as researchers in academic. I'm talking of academic because this is more of academic sessions. So we have types of researcher's position. You can be a researcher, but a participant in your study. And you can be a researcher, but non-participant. If you are a participant, it means that if you go there collecting data, you are also part of the study population. You see. So, for instance, you are doing a qualitative research, finding some cultural norms that are relating the eating habits among disabled people. For you to get, it's what sometimes they call it as grounded theory. for you to get information from them, you need, if they are singing a song, you should sing also. If they are playing local, maybe local ceremonies, you need to join and play while you are collecting data. You are playing the dance, and then you are collecting data. You see, if we are doing such a thing, such a position, mean that you are a participant researcher. But if we go there, leaving them dancing, and you are sitting there aside, looking at them and collecting data, observing what is happening, and you document it, you are called a non-participant researcher. So you need to consider, in this research, am I going to be a participant researcher or not? Sometimes you are asking, who is going to administer a questionnaire? And you are saying research assistants. Why? Because you have put yourself as non-participant researcher. And then sometimes you are saying, me as a researcher, I'm going to collect data from the participant. You participate, I say. So you have those kind of situation in the position of participant, but in the position of principal investigator or research assistant, the position of the researcher. And then here again, we need to answer why this population and how are you going to get it. And more of the details will be also found in the study sampling procedures later. I think we are going to touch all of the components if God wishes. So these all are the descriptions of what is study population and what is target population. Target population, as I said, is a concept broader to specific. And then from the study population is where you get a study sample. See, so we have these three figures: target population, study population, the sample, study sample. So that is at least a basic knowledge. It's not a whole descriptions of what is study population, but I've tried to fish some information that I thought that is very meaningful, and it will help you to understand what is a study population. And then this information based on my experience in research, but also reading books and the scholarly works that are available. And then you can access them books. You can find more information about those aspects: study area, study setting, but also study population. Yes, this is an example of the description how to write a paragraph on a study population. And then I leave it to you as a brain teaser. When you have time after this session, you can read and critique it and find the appropriate answer. If you were you, how could you write it? The same sentences. And then you are asked, what could you write as it is without deleting anything? And then what could you add for it to qualify as a paragraph describing the study population? Let's say, what could you modify? Such questions need to be asked. You need to ask yourself, if I could be me, given this paragraph describing the study population, could I live as it is? If yes, no. If I could be asked what to modify, what could I modify? You ask yourself. And if I could be asked what add, what is missing? What could I add? So I've put that one for as a brain teaser to a time after this session and more, because we are here. We can ask you. You can ask a question, whatever, even after the session. It's not necessarily within the session. You can also share experience. How do you understand and how do you know about it? So that's all about what I prepared for you on the study setting and the study population. So thank you very much.
Thank you so much, Dr. Walter. This has been very informative. And myself, I've been saying wow on every other slide. So there's a lot of things that being I wasn't aware of. And thank you so much for that. So before we go to question and answers, I would like to invite Hindu to speak for a bit so we can go to a question and answer session. Sister Hindu, welcome.
Thank you. Good evening, everyone. Thank you, Dr. Walter, for a very wonderful presentation. I just want to add some minor issues with regard to the study population. There are some areas which you concentrated and said with regard to how to reach the study population for the eligibility criteria, including the exclusion and inclusion criteria, because some of the people, sometimes they do mix the inclusion criteria. They think the exclusion criteria is the opposite of the inclusion criteria. I just want to touch minor on that. The inclusion criteria, these are the features that the respondent or the study population have and whom they will be involved in or will be selected to be included in the study. For example, the social demographic characteristic, it can be age, it can be education. Also, it can be even the geographical characteristic. They might be some of the issues to include people within that study. In contrast to exclusion criteria, these are the features also. They involve a person to be included in the study. But those individuals, they have some additional characteristic which could hinder them to participate in the study. For example, you might study the behavior of adolescent. As we know, the adolescent are the people between the age of 10 to 19. But you can decide to study the adolescent who range between the age of 10 to 19. And that is one of the characteristics in the inclusion criteria. Also, those who will consent to participate in the study, that is one of the inclusion criteria. But when you come to the exclusion criteria, some of them, they say, those who will not consent, they will be in the exclusion criteria. That is wrong. The exclusion criteria is not the opposite of the inclusion criteria. Maybe it could be those adolescents who will be sick during the study, that will be the exclusion criteria. It means you will not involve them during the study. That is the point that I wanted to touch with regard to inclusion and the exclusion criteria when you are selecting your study population. That is on that, Dr. Z. Hello, Dr. Z.
Yes. Okay, thank you so much.
Just minor addition, because he has talked a lot and exhausted in everything.
Okay, so thanks a lot, Sister Hindu. And now I welcome the floor for questions. And I see there is a comment. Let me try to check quickly. Okay, so the participant just say thank you so much for a wonderful and informative session. So participants, now you can unmute yourselves. If you have a question, you can directly speak and ask the speaker any question or comment if you have any. And please, when you start to ask a question, if you can introduce yourself, then it will be nice.
Thank you so much. I want to take this opportunity just to thank the presenter and the organizer and the team. I'm Upendo from Ministry of Health, Division of Nursing and Midwifery. I'm glad to hear what is presented. Although I'm a bit late, a big congratulations, Dr. Walter. Nice and good work. But I appreciate everything, although I joined a bit later, but I have some concern or advice on this a very, very informative and a very, very important area, which is a big gap for the nursing and midwifery cadre. So it's good at least to arrange the time which will be conducive so that we can share the link to the different people. At the end of the day, we can have large number of population which will will join the link, and they can learn a lot. Myself, I learned a lot, and I think, and if the link could be shared early, we have a group for nurse supervisors all over the country based on the nursing issues and different categories. We have DNOs, RNOs, RR stage course. So if we can share the link area, I think majority of nurses can join, and they want to pursue different level of their career. So I think it could be very, very advantageous to all the people whom whom can benefit with this session, because as you know, once you develop your career, you can't avoid the research. And we are coming from different background. Some of the lectures are based on the research issues. They can rush things. So once you grow higher, you see, you make a lot of challenges, and some of the nurses, they have been disappointed, and they think they are fed up, because once they think about studying, they are demoralized some issues based on the previous lecturers or whoever who taught them. So I think this session, and myself, I'm coordinating capacity building. So I'll be glad once you prepare this, you just communicate with me. I can share this link for the different group, so that I'll be very, very happy to see a lot of nurses that will be benefited on that. And more of that, we are welcoming you even to visit us in a Ministry of Health. We'll be happy to see you and plan together, because we have a very good plan based on the communicating to the different careers, so that you can be very strong, very energetic, and then we can share not only for nurses, even the doctors can benefit. So thank you so much. But my question, we need to explain more on the population. I like it. I benefit from some few things based on the human and non-human population will be broader than sample. So we need to be deep on that area and other areas. We know once you talk about concept notes, it's a bit, but you have to be very keen on what you are writing, because some lecturers can see one line and cancel everything. So a big congratulations and very, very thank you for all organizers of this important presentation. Thank you so much.
Okay, thank you. Thank you so much for your comment and advice. We will work on that and make sure that you also get the link earlier. So if you can share your email to Hindu or Walter, and then I can get it and I'll be sharing with you the link. Dr. Walter, do you have any response?
Yeah, I think it's good, and based on the nature of the sessions, because the intention is to disseminate research understanding, research knowledge to a large group of people in the country and outside the country. I think she has raised a good concern, and if you accept it and put it into your consideration, that would be very meaningful to this session that we are conducting.
Yes, definitely, we will do that. Okay, do we have, okay, Sister Hindu, welcome.
Okay. Thank you, Madam Pendo, for your contribution and congratulations. But in the previous days, Ms. Ziada called me from your directorate with regard to this training to be in the whole country, as we are organizers, and there are some conditions that I gave her so that we can do what you suggest. I think you can talk with the others and arrange it officially between Ministry of Health and Benjamin Mkapa Hospital, because initial also we prepared for the benefit of our people, but you cannot hinder the education to be taken by others. So, but we can see how we can accommodate others official, because there are some costs to be incurred that the Benjamin Hospital incurred, and it was for. Hello.
Yes,
Hello.
we can hear you very well.
Yeah, we are listening. Sister Hindu, we are listening.
Okay, okay. So we can arrange it official. Maybe we can communicate between you, the other, and I, and see how we can spread the knowledge to others.
No problem, because the other, she's my boss, we can communicate, and we have good plan. And apart from Benjamin, ministry again, we have a link, so we can invite presenters by using our link so that people can join. So maybe we need to sit together, welcome DNMS, we can have short meeting, and then we can discuss in details on how we can go about. But that rather than you can arrange anything, I mean all of the plan, and then we can share with us, then we can ask you for the link.
Okay, there's no problem.
Okay, any other question? Do we have any other question or comment? Or anything that you want to advise to make this better? Okay, we have a comment from Dr. Walter Msilikale from KUHAS. He's assistant lecturer in epidemiology. He's saying, thank you for the informative session. I would like to receive a link for these sessions in the future. Okay, we will send the link, and also we upload the session. We also have all the sessions that have been done in the YouTube channel, so we will share with the other participants. I think Dr. Walter has some network connectivity problem. I think he has left. I don't know, maybe he can rejoin. So while we are, okay, so I think he's back. Do we have any other comment or question?
Sorry, Dr. Zadi.
Okay, welcome.
I was lost in network. I didn't hear the comment. Can you reshare it?
Okay. So there is a assistant lecturer from KUHAS, the Department of Epidemiology. He was asking if he could get the links to this session and other sessions. So I was responding to him.
Okay. Yeah. Okay.
Yeah, so thank you very much for the session. My name is Dr. Mugisha. I was suggesting that we find better ways to disseminate the information so that we get many people to come. And this need to advertise, like for the course that is going on now. I've just learned that these are two important basic research trainings. And we have different categories in terms of research career. Some are very basic, some are mid-level, some are high-level, early career, and some are gurus. I think having the cross-cutting level of discussions along the presentations and along the discussions should cut across all the levels, and probably can attract experienced researchers, mid-level researchers who can share the experience on the platform, and we all benefit from it. Just a suggestion. Thank you.
Okay, thank you, Dr. Mugisha. We also would like to have some other researchers and other experienced people who would like also to give out sessions. We have a list of a lot of topics. So anyone in this platform who would like to also give a talk in the future can communicate with me or Hindu, and we can see which topic you want to present or talk to give out, and then we can work on that. Hindu, welcome.
I would like to respond to Dr. Mukisha with regard to the basic element of the topic that we have started. We decided to start with these basic elements with regard to our research format so that most of the people can start at the lower level, at the middle level, then later on at the highest level. So we are starting with basic elements first, then we'll go to further on those hardest parts. And these are regarded to with regard to our Benjamin Mkapa Hospital research format. So these are some of the elements or some of the parts that which are being taught. They are from the Benjamin Mkapa Hospital research format. That's why we started with the introduction, the first part, the chapter 1. Then we went to the literature review, chapter 3. Now we are in the literature review in the chapter 2. Now we are in the chapter 3 of the methodology. Then we'll go on up to the discussion conclusion up to the last with regard to our research format so that everyone can know the basic element on how to write the research.
Okay, thank you, Sister Hindu. Do we have any other comment? Okay. So I think now I will welcome Dr. Walter to give a closing remark, and before we end the meeting for today. Dr. Walter, do you have any take-home message or the last or any closing remarks?
Yeah. Yes, the take-home message from this session is the issues, the critical issues, the consideration that we as researchers, beginners, sometimes need to consider when we are framing our research methodology section, because it's a very challenging section as compared to the background and also the literature review. And then here is where we need to answer the methodological gaps, the new knowledge that your research intends to bring in terms of methodological procedures. Are they different from methodological procedures that are existing from previous scholars? What is method which is new that people will depend on them when they want to conduct research as you have conducted? So this is my take-home message, that frame your methodology section for your readers to say, wow, this is a wonderful methodology section. That is the first one. And then the second one, frame and write your methodology section for your readers to know new knowledge of methodological procedures or activities that you are going to contribute to the existing knowledge. So that's all. Thank you for you all that you have joined this session. And I thank you for your comments and some of questions. Let's keep up and then make scientific researches to our juniors and even ourselves at the middle stage and even to seniors. Thank you very much.
Okay, thank you, Dr. Walter, and thank you also for being always active and available whenever we need your support, and also whenever we need your time to participate in these sessions. Sister Hindu, do you have any closing remarks?
Just to thank the participants. Let's stay tuned and hopefully we'll meet again. Thank you for your time and contributions. Thank you.
Okay, thank you. Thank you all for being with us today, and especially those who have been from the beginning to the end and those who have joined in the middle. We appreciate your commitment, and also we also like to encourage you to attend the upcoming sessions, because all these sessions are small pieces that will add to a larger pool of knowledge that we have started. So thank you very much. We will have we'll have another session in the next Wednesday, but the Wednesday after, because we usually have sessions every other week. So every month we have 2 sessions of this, and we will try to share the link as early as possible so that we can have more people actively during the session, even though we know that we have people who will come at their own time and review the recorded sessions. So thank you very much. We have had participants from different parts. We have had participants from Dar es Salaam. We have had a majority of our participants were from Benjamin Mkapa. We also have had participants from the Ministry of Health. And I had a colleague of mine, a Tanzanian who is in Germany, also participated. So thank you very much and have a great evening.
Okay, thank you.